Hello, Untamed television fans. So nice to have you here today joining us. We're going to talk with a new guy. I mean, he's new to you, he's new to me, he's new to our area. He's just all-around great new guy. This is Jason Fugelberg. Did I get it right?
You did.
I got it right. Jason Fugelberg, who is the new Chief Nursing Officer at Brigham City Community Hospital. You know that hospital up there in Brigham City, right there on Medical Way. And Jason is joining us today to talk a little bit about what you can do for your loved ones when they're in the hospital. So, first off, give us a little bit of your background, Jason.
Yeah, so I've been a nurse, 6 years now, and I've been a Chief Nursing Officer for 5 of those 6. And
Wow.
yeah, I've been a Chief Nursing Officer in Idaho, Maine, and now Utah. So.
Wow. I imagine there's people out there right now wondering what a Chief Nursing Officer is. Is that an easy thing to explain?
It is not an easy thing to explain. Really, I'm just there to support the nurses and make sure that I remove obstacles in their day to help them care for the patients better and really to make their jobs easier. So if I'm not doing my job well, then their lives are difficult. And if I'm doing a good job, then they're taking care of patients and doing what they need to do.
Great.
So.
You like your work, I can tell.
I do.
I mean, I really can tell.
I do.
I can tell. And you are a nurse, so you can give somebody a shot if they need it or whatever.
I can, absolutely.
Right. Well, we invited you on the show today because I thought you had an interesting topic about talking about what to do and how to care for your loved one in the hospital. I mean, everybody at some point has someone in their life that goes into the hospital. And we're not here to talk about what happens when you go into the hospital, but when somebody you love goes into the hospital. Pretty common.
Yeah. Well, hopefully not too common.
Yeah.
But yeah, I mean, every now and again, someone that we know in our family, they get sick, and they get sick enough that they have to go to the hospital. And there are things that we can do that can make their stay just a little bit better as family members. And so, yeah.
Well, let's talk first about the short hospital stay.
Yeah.
Okay, somebody that comes in for maybe a hip replacement or carpal tunnel syndrome, something like that. So they're going to be there a day, 2 days, something like that. Tips for taking care of somebody for just a couple of days.
Yeah, I think really the important thing is, when they go in for surgery and they're in there for a short period of time, they come back out, it's always nice for them to wake up to a familiar face. So being there when they leave the OR and get admitted to the medical surgical floor, that's important. It'll make them feel comfortable.
Right.
So
if you can't be there, just send your face.
yeah. Well, actually, we've had family members that have sent pictures and had them waiting in the room for when the patient gets there. So
and that's a good idea too.
It's a nice touch, and it lets our family members know that we're thinking about them. But I think another thing that we can do, just being present for a lot of the communication that goes on. Nurses, we give report to each other in this transition of care, and it's always nice to have family members there because, as a patient, you're focused on getting better. You're not so much focused on listening to what the nurses have to say, and you just, sometimes you don't feel that good, and
yeah, there's medications involved.
Absolutely.
And you're under a little bit of stress, and it's kind of hard to do that. You need that family member there, paying attention and listening.
Absolutely.
Yeah. So I've actually seen people pull out their phone and say, "I'm going to record this. Is this okay?" The nurse's instructions. How do you guys feel about that?
Yeah, I think it's appropriate as long as there's consent from the patient. We have policies that guide that, so that we're not invading the privacy of a family member. But yeah, I mean, if that's what needs to be done to capture that information so that you can go over it later and help your loved one through any questions they might have, I think probably the best way is to sit down and write notes.
Okay.
And so a lot of people use their phones for that, but
sure,
good old-fashioned pen and paper.
Yeah.
That works too. Just write down the questions you have, or write down keywords. If you don't understand the words that are being used, then write them down and ask the nurse or the doctor to explain them.
Right. I think that's really important too, because I think I was in a room one time and somebody said, I don't know, otolaryngeitis or something, and I was like, and I didn't know what it meant. I had no clue. So it's okay to ask, right?
Absolutely. I mean, that's what we want, and as patients and family members, you're the biggest part of the healthcare team that there is. I mean, as nurses and doctors, we have our job to take care of your loved one, but family members are a huge part of the care team, and so we want patients and family members involved in their care. We want them to ask questions. So
okay, let's talk about something that's always it's always kind of a strange subject, but you need to know what should you take somebody in the hospital and what should you not take somebody in the hospital. I mean, if I'm going to go see if I have a friend in the hospital, flowers, is that okay?
What, for what do you say again?
For flowers.
Oh, for flowers.
Yeah, if I'm going to go visit somebody, I probably made it sound like flour, like a 10-pound sack of flowers.
Yeah, no, I mean, it depends on their diagnosis. I mean, if it's somebody that's in the hospital and they're for example undergoing some type of chemotherapy or something that's going to suppress their immune system, fresh flowers and things like that actually have bacteria and things on them, then it's probably not a good thing. But in most scenarios, flowers are fine. One of the things that usually is a no-no is latex balloons. We're latex-free facilities, so
right.
A lot of people have latex allergies, and we just don't want to harm anyone when they come to the hospital. Our goal is to get them better. So yeah, flowers would be fine. Like I said, pictures.
And backing you up on the balloons, those Mylar balloons, which are the ones
Those
that
are
just so that you people out there, in case you don't know what they are, they're more the rounder ones.
Yeah, they're like
and they're
shiny.
flatter and they're shiny. Those are okay because they're not made out of that latex.
Correct.
Rubber.
Yep.
Yeah. So you can take them. It's probably a good idea to ask their caregiver, right?
Oh, absolutely.
If you've got a chance to.
Yeah, if you have a question about it, just ask the nurse or ask the doctor, and we should be able to steer you in the right direction.
Should you take them treats? I mean, donuts?
Well, I mean, we all like treats
when I'm
and donuts,
in the hospital,
right?
I want donuts.
It just depends on what their recovery is. If they've just had a major procedure, chances are they're probably going to start out with a liquid diet.
Right.
So if I had a donut sitting in front of me or a piece of cake and I had to drink liquid, that would be torturous.
Sure.
So, again, if you have questions, ask your provider or your care team, one of the nurses, and they should know what's appropriate as far as food.
I mean, in the hospital, nowadays you can pretty much get about anything that you really want.
Absolutely.
I mean, you can have a soda if that's within your diet. You can get a full meal. You can have a treat. Those sorts of things. But pets. What about pets? Do we allow pets in?
Good question. I'm not exactly sure what our policy is, but most hospitals do not allow pets unless they. Usually, what they do is they have like a program where they have like pet therapy or something like that. I don't think that we do that at this time, but those pets have, they have papers, they have proof of their immunizations, they have certain behavior that, and there's also usually a specific entrance that they come in, and so that's kind of a touchy subject.
So don't bring pets.
Probably not a good idea.
Or if you must, speak with the physician.
Again, ask if you have questions. But most of the time, typically in the hospital setting, our goal is to get people well quickly and get them home. And so hopefully it's only a couple of days, without the pets.
Should you visit if you've got a cold? I mean, this seems like common sense things, but people will ask. We people that are in the hospital are compromised, and we don't want to, again, we don't want to harm anyone. Our goal is to get them better. And so if you have a cold, it's typically not a good thing to come and share. Yeah.
So.
Children, I mean, what's like a basic age to bring a child into a hospital? I mean, I know everybody wants to see their kids, and probably an in and out thing is okay for a 1-year-old, but how long? Yeah,
I mean, I think my rule of thumb is the younger the age, the shorter the visit, probably for the patient's sake, but also for the child's sake. They don't want to be in there any longer than they have to, but I don't know, school-age kids, probably a very short visit. As the children get older into their teens and stuff, a longer visit would be more appropriate. One of the things that we often forget about is, it takes so much energy to get better and to recoup, and oftentimes we kind of overdo it, and we bring in all of our family members, and it can be really overwhelming and stressful and take a lot out of the patient or the family member who's in the hospital. And so it's important to remember that they need their time to rest, and it's good to see them and show the support that you're there and that you love them, but sometimes it can be overwhelming.
Okay. What about like personal items like favorite blanket, favorite pillow, stuffed animal?
Yeah, that's great. That's
what if you have a little teddy bear you have to hold on to? Asking for a friend, by the way, not me. But I mean, is that okay?
Yeah, that's fine. I think you know, when you talk about items, one of the things that comes into mind that we often forget, things like glasses or dentures or hearing aids.
Yeah.
It's very important to be able to communicate with the patient and with your family members. And so, you know, being able to, you know, feed them and have them be able to chew and eat, you know, if they have dentures or, you know, hearing devices, it just makes communicating, you know, it's more safe, and it makes it easier to care for your loved ones. So.
Okay. How do you communicate with the nurses? What do nurses prefer? Do they, I mean, do they, I don't, I actually don't know what kind of a question I'm asking here. I mean, obviously you want the family member involved, you know, because with the patient's care, but do you want them to update you on everything? You want them to tell you the important, I mean, again, I don't know what question I'm asking here.
Well, I guess just going off of that, I really think that any major change in behavior should probably be reported to a nurse. If your loved one is acting differently now than they were even a couple of hours ago, that's something that you'd want to report to a nurse. Obviously, like any allergies they may have, you definitely want to report. But as far as communication goes with nursing, you know, we have that handy call bell. You know, the nurses respond very quickly to that. So if a question needs to be asked, or if, you know, communication needs to be had, we just push that button and we'll come right in. But that's also why I mentioned, you know, being there at change of shift, or, you know, when the care teams are crossing, to be able to be there and ask questions of the nurse and communicate that way as well is important too. So
probably the best thing to do. Okay.
Yeah.
Hand washing. Let's talk hand washing.
Absolutely.
When you're visiting someone in the hospital, wash very, very well before you go in, correct?
Absolutely. We usually, you know, we tell the nurses, you know, if you don't know how long to wash your hands for, at least sing your ABCs in your head, and that's about the length. You know, hot water with soap. So that's important for family members as well as nurses. So if you have a nurse that comes into your room, or a doctor, and they're not washing their hands, remind them. You know, that's on us. We need to do that, and we do a very good job of that. But that's one of the most common things that we can do to reduce infection.
Sure.
So,
and when you leave your visit, what do?
You wash.
You wash your hands again, so you're not taking it home, right?
Absolutely. You don't want to take any of those bugs home. So
that's great. Yeah. That's great. So we do want you visiting your loved ones when you're in the hospital. And Jason, being a nurse, he knows all about these kind of things. But we do want you to be careful. We do want you to take precautions to mostly protect them. Remember, that's who you're protecting.
Absolutely.
Yeah,
absolutely.
Is protecting them. Jason Fugelberg from Brigham City Community Hospital, the brand new Chief Nursing Officer. It's been great to have you here with us today.
Thank you.
Thank you. We'd like to have you back and like to hear more about all this stuff.
Absolutely.
And you folks out there, we appreciate you watching Untamed Television. I'm your host, Craig Bielik. I hope to see you again. Thanks to all of you that stop me and say hello and say, hey, I see you on TV. It makes me feel good. Thanks again. See you next time.
Great.